Alright, this is going to be a video on patient packaging in a Stokes basket. We have a Stokes basket and we'll need a couple of different types of webbing. We'll need a 25 to 30 foot webbing as well as a 12 to 15 foot webbing. Depending on the size of the patient, the lengths of that webbing may need to be adjusted. There's a lot of different methods of packaging a patient in a Stokes basket. I try to keep it simple, and as long as we're all the different ways have the pros and cons, but what's most important is that we're all doing it the same way. If the patient has any suspected spinal injuries or long bone fractures, we would have to patch them on a long spine board along with cervical protection to start out with. So we should already know how to do this. We're just going to strictly cover packaging the patient in the Stokes basket. The first thing we need to do is secure a seat harness around the patient in case the Stokes basket becomes inverted. It'll prevent the patient from sliding down in the basket. So that's where a 12 to 15 foot piece of webbing is going to come into play to tie that seat harness. First thing we're going to do is find the middle of it. And you want to place the middle of the webbing around the patient's navel. What we're going to do is separate the two strands and come underneath the legs. Try to minimize the twist. All right. And that first loop that we had, we're going to take the ends of the webbing and come up through the bottom of it, creating the leg loops. All right, what we want to do from here is tie an overhand knot on each side of the leg loop to prevent that from cinching down and cutting off the circulation of the patient. We're just going to tie a simple overhand. And that's going to prevent that from cinching down around the patient's femoral arteries. What we want to do then is come up to around the patient's shoulders and tie a clove hitch to secure the patient and prevent him from sliding down. Remember, anytime we tie a clove hitch, we want to back it up with an overhand safety. Just like any other time we're packaging a patient, if the patient has an unstable pelvis, obviously this is going to be very uncomfortable. If it starts to support his weight, we would want to pad that patient with blankets and pillows as much as possible. Try to stabilize that pelvis. Right, so that's step one. Now if the basket becomes inverted, the patient won't slide out of it. And the second step is going to be to lash the patient into the basket. That's where 25 to 30 foot webbing comes into play. Again, with a larger patient, it may take a longer piece of webbing, but we may have to tie two pieces of webbing together. Again, we're going to find the middle. We're going to start down low around the patient's ankles. Remembering that we always want our webbing going around those vertical posts. We never want to go around the top rail, because if that basket rubs against another object, it could damage that webbing. Right, so we're going to start around the patient's ankles, going around the vertical posts. And we're just going to crisscross. Continue that process all the way up. Now we always want to make sure that there's going to be an X at least across the patient's lower leg, across the hips, and across the chest. Once we get to this point, which post we choose to tie off to, it's going to depend on the size of the patient and where they're oriented. What we want to do is try to come across the chest and shoulders, but we want to make sure that we don't come up too high and go across the patient's neck. So So with this particular patient, we could probably go to that last vertical post. So what we want to do from here is tie off one side first and then work the slack all the way through before we tie off the last one. Of course, normally the patient's arm would be down by his side. This mannequin has seen better days, so that's not going to work. Again, here we're just tying a clove hitch with an overhand safety. Here we'll just work the slat all the way through. Now we can tie off the other end. Cut. How we attach our haul system or lowering system with our Stokes basket is going to depend on whether we're raising or lowering it in a horizontal or a vertical fashion. If we're doing a high angle, raising it in a horizontal fashion, we would use the pre-made adjustable Stokes basket bridle that we carry. For a low angle, where we just want to attach to the head of the Stokes, we can just very simply do that with a short piece of webbing. I'm just going to wrap it around the top rail. This is generally the only time we wrap around the top rail. We want to make sure we get one on the outside of those two vertical posts, one in between, and one on the other side. Then we're just going to tie an overhand bend to join the loop together. Then we're going to pull two strands, just like creating a wrap 3 pull 2 angle system. Put our carabiner in, and that'll be our attachment point for a low angle haul. Alright, next we're going to go over packaging a patient in a sked. We typically use the sked for low angle rescue. We don't generally use it for high angle, we use the Stokes for that. For low angle rescue, it provides us with some good options and benefits. Number one, it's lightweight, compact, and easy to carry to remote locations. Number two, if we're doing a low angle rescue, the sked is a nice smooth surface to it. So if the surface of the angle that we're trying to bring the patient up or down is smooth enough to allow, rather than having to have rescuers support the weight of this, we can just attach a haul or a lower system to it and move the patient along the slope. So it makes things convenient and very quick for us. The way we package a patient in this is a little bit different than what the manufacturer recommends. The manufacturer recommends attaching the webbing straps and then lacing the rope down the sides. The problem I have with that is then you're putting all of the patient's weight on the webbing strap and these lightweight little metal buckles. So we're going to do things a little bit differently, where we utilize a 7/16 life safety rope to support the weight of the patient. First thing we want to do is attach all of these webbing straps. These are basically going to hold the sked in place for us while we weave the rope. Just like with the Stokes basket, if the patient had spinal injuries or long bone fractures, we could stabilize them with a backboard and appropriate cervical protection before packaging them in the sked. And we're going to take the straps on the foot end And we've got 2 sets of grommets here. We can use either one. Again, depending on the height of the patient, we'll determine which one we use. The rope stays pre-connected at the head end, so we really only have to start at the chest level. And what we're going to do here is just weave it back and forth, just like we did with the webbing on the Stokes basket. Make sure that you run your rope underneath the webbing straps. Then I'm going to come through the grommets in the bottom of the skid. Alright, from this point, he's going to hold tension while I'm going to make sure that all of the slack is out of the rope. Alright, we're now going to finish securing this using a square bend backed up with an overhand safety on each side of the square bend. Now that the patient is secured in the sked, we have multiple options for moving him. We have carry handles on the sides if we wanted to carry the patient. Pivot him around. We're just going to be moving him along flat ground. We have a drag handle. And if we need to use a rope system to move the patient, we just attach to the figure 8 on a bike at the end of the same rope that we use to weave the patient into the sked.